This is Share the Vision, presented by the Resource Center, a discussion of the programs and services of the Resource Center and about issues related to individuals with disabilities. Today, we visit the School-Based Health Center at Jamestown High School to provide an introduction as to why we're here and what we hope to accomplish over the next half hour. Let me first introduce Steve Watterson, the Director of Community Relations at the Resource Center. Steve, hello.
Hi, Dennis. How are you?
Well, I'm happy to be back here at the School-Based Health Center and kind of catch up on some programs that we've done in past years for School-Based Health Center Month.
That's right. February is National School-Based Health Center Month, and the Resource Center and Jamestown High School have been partnering for, I think, 11 years now to have a school-based health center that operates within Jamestown High School that can meet the health care needs of students right here on campus so that they don't have to leave the school to have their health care issues addressed.
So let me say this back to you so that the listeners and I both understand how this works. This is actually a Resource Center facility operating within the confines of Jamestown High School.
Yes, sir.
Introduce me to the person who's responsible for all of this.
Well, the person who's been responsible for all of this since we started is Debbie Piotrowski, family nurse practitioner who has been here and been the face of the SBHC ever since we opened up.
Deb Piotrowski, welcome back to Share the Vision. It's really a joy to be able to sit down and talk to you once again about your work here.
Well, it's nice to be here again and talk with you.
How are the kids in terms of the young people that you see here, the things that they are dealing with, things you are helping them cope with in their lives, in their health, in their growth? How are the kids today, Deb Piotrowski?
The kids are different even from when we first opened the School-Based Health Center. This May, it'll be 12 years. We opened in May of 2005. And I didn't have as much mental health to deal with then as I do now. And I don't know if it's because there's more mental health or I'm screening for it more and finding it, but that's a big thing, is the mental health piece.
What are the mental health issues that you encounter among the high school age population? So we're talking people 15 to 18 years of age approximately?
About 14. With the ninth graders are 14. A lot of depression, anxiety, family dysfunction issues, and that can be like a variety of things where maybe it's a single parent and there's another adult in the home. Maybe the child doesn't get along with that person, it doesn't get along with the people in the home in general. Families aren't the families like 20, 30 years ago where mom and dad were in the home and everybody sat down for dinner, and school, you were expected to do well and attend school. So there's a lot of that. There's a lot of abuse that I deal with. It can be physical abuse, sexual abuse, verbal, emotional abuse, a lot of domestic violence. Either the kids were exposed to it or they're actually part of it. A lot of substance abuse, and that's really just the top part of it that I see.
You are on the cutting edge, the front lines of some of the greatest challenges that we face, that young people face, that we face as a culture in your work here at the School-Based Health Center. I just wanted to put an exclamation point on that. What hope, what help can you offer to those people who come to you with mental health-related issues, Deb Piotrowski?
When they present, it doesn't always look like a mental health issue. And what I mean by that is maybe a kid gets referred to the School-Based Health Center because of an attendance issue, or they're falling asleep in class. Well, I don't see it as an attendance issue or falling asleep in class. The first thing I think of is what happened to this kid, or what's going on at home. Are they safe in their house? So there's some mental health screening tools that I've learned to use. And we'll talk with the child, and depends on how the encounter goes on if they get a referral then to a mental health counselor who are actually housed in the high school through Family Services and the Resource Center.
So there are pathways available for them to improve their mental health.
Yes.
Deb Piotrowski, I want to get into other issues related to physical health and the other things that you encounter here on a regular basis in a moment, but it seems incumbent on us at this point to fall back one step and talk about how the School-Based Health Center fits in to the rest of the health care providing picture in our community in terms of Do you take the place of a physician, or do you work with physicians? How does that blend together or work for many of the young people that you see?
Most of the kids that I see already have a primary care provider. Electronic health records are great. Once I see the child and treat the child, then I just send my record over with the documentation of the encounter over to their doctor. I don't take the place of that person. I work with them to help keep our shared patient healthy. If a child doesn't have a primary care provider, the school-based health center can be that. But I don't take the place of that person. I keep them in the loop of what goes on with their patient at the school-based health center. If I'm very, very concerned about that child, I call the PCP's office directly and speak with somebody there to express my concerns. Obviously speak to the parents about any of those kinds of concerns that I have. But we really reach out to the community for resources that are out there as well. We have mental health here, and that's really convenient. But our other mental health partners in the community are widely used as well. And just like a PCP, really, if I consider a child's primary mental health care provider an important piece of that person as well, and will communicate with that person when I feel I need to.
How do people sign up for services here?
They can either call us, and the number is 483-4373, and ask for us to mail home an enrollment form, or they can send their child in and ask for an enrollment form. It's one page, one signature, consent for me to be able to treat them.
And that's all it takes?
That's all it takes.
But that is necessary for every student you see?
Yes, I need parental written permission to be able to see. It's like a doctor's office. They can't see the kids without a written signature.
One other just practical question, and that is, we hear a lot about insurance and whether people can have insurance or if they had insurance, and that's a very fluid and contested issue in our culture, our politics right now. How do you handle issues like reimbursement and being able to be compensated for the services provided here?
We do bill the child's insurance, okay, but not all insurances reimburse us. And I don't know all of those answers. Savannah Coletti is our registrar / biller / all the other things that we need her for. She wears a lot of hats. So she knows more about the reimbursement and that type of thing, because I just ask her when I have insurance questions.
She sits opposite us and will make a brief appearance on the show if time permits in a few minutes. But there are some essential issues that we need to get to between us, Deb Piotrowski, considering, well, how many young people would you see in a day or a week here yourself at the school-based health center?
This morning I've seen 15 already. It's a pretty high-volume health center, and if you count all the kids that include the walk-ins, and it might just be a first aid type of visit, but we see usually 30 to 40 kids on a daily basis. Of that 30 to 40 kids, probably at least 20 to 25 are billable, which means I see them, diagnose them, and come up with a treatment plan. And then the rest are the first aid kids that walk in for headaches, might just need some Tylenol or ibuprofen, menstrual cramps, cold symptoms that they just need an over-the-counter medication to help relieve their symptoms so they can sit in their class and pay attention. But it's a pretty busy health center.
We spoke extensively in the opening minutes of this program about the mental health challenges that have arisen over the years that you have been here and operating this school-based health center. What are the primary physical, general health issues that you deal with in the population that comes to see you?
It's really a lot of respiratory illnesses, and it's the viruses that are in the community in general. We have an influx in influenza-type symptoms now. Last week was a GI stomach bug. The week or two before that was a respiratory illness with a really bad cough that lingered for 3 or 4 weeks. And then your usual, the abdominal illnesses. We do contraception. I do a lot of asthma visits. The type 1 diabetics, which are the kids who are dependent on insulin because their pancreas doesn't make their own insulin, I don't manage those kids, but I touch base with those kids to make sure they are connecting with their primary care provider and whoever, usually is Women's Children's Hospital Buffalo, that manages their diabetes, just so these kids don't get lost in the system and not get treated for their chronic illnesses.
You are on the front line in another way in interacting with young people, and that was demonstrated or is demonstrated just by the rack of information that's available, brochures, cards, and other things right at your front door here. Issues of bullying and hazing and sexuality and alcohol and drug-related issues and STD testing and exercise and diet. I mean, it runs the full gamut. You have 2 walls full of information here. You can't walk in here, at least for me, I couldn't walk in here as an adult and say, wow, there's a lot of things, a lot on a kid's plate in terms of decisions that they make and how they use their bodies and how you must encounter them in that decision-making process or the results of those decisions regularly here. Am I on the right track?
You know, most of the time the kids come in looking for help of some kind, whether it's medical help or mental health. And in talking with the kids, you really, between me and the child, we come up with what they're really looking for, what they're seeking. And so based on that, it's individualized for each patient. Every encounter is different. Like, no, I don't do the same thing twice in a row.
A moment for you as a person, because this is obviously demanding work. You're going to see 30, 40 patients a day for now 11, going on 12 years. Talk to me about how the work has shaped you, Deb Piotrowski.
It is a really rewarding work. When we first started, there weren't a lot of successes. And what to me a success is a 9th or 10th grader who probably would have dropped out in high school. We're seeing a lot of those kids graduate now because they're linked with services. I don't do this by myself. There are teams. There's a team in the school. There's a team in the community. It's people working together to help get these kids to be successful and graduate from high school. The mental health piece, though, is really, like, sometimes it really takes a toll on you. You know, sometimes it depends on what was disclosed to you that day, or sometimes more than one disclosure. It's really tough. You know, it's the provider taking care of the provider. And we don't often think of that. It's like when you're a mom and you're dealing with your kids as your kids are growing up and you don't take care of yourself, and then eventually you take care of yourself. But all these mental health kids, I'm learning a provider has to take care of a provider. You have to take care of yourself first, too, so that you can continue to help these kids.
A provider needs to take care of a provider. Just explain that a little better. Are you talking about things that you or other providers need to do in order to ensure that you have the resilience to
It's me taking care of myself so that I don't get burned out with this mental health. And the medical illnesses aren't bad. It's the mental health piece that really takes a toll. And it's mental health counselors go through the same thing. You know, you hear a lot of stuff from these kids.
So we would be surprised, shocked at the types of things, the quantity of again, we're back to mental health issues that are in the students that come to see you.
Yep. You know, a city as small as Jamestown, you would not think of some of the trauma these kids have been exposed to. There are kids who have witnessed murder. There are kids who have witnessed a spouse or partner beating up their mom or their dad to the point of needing hospitalization. There's sexual abuse kids have witnessed, or it's been happened to themselves. I could go on and on and on. I had no idea until I came into this job how much trauma is out there. And I'm actually going through, it's called Solution-Focused Trauma-Informed Care. And it's through the University of Buffalo. And it's a once-a-month training right now. It was a 2-day training at the beginning. I'm a year into it now, so I have 3 years left. And it's a valuable tool for me to have at this point.
Wish we had time to pursue that with you a little further, but there's a few other things we need to do before our time escapes us, and we do need to jump to one other location to meet one other person who's a key part of your school-based health center who doesn't happen to be here today. But Deb Piotrowski, thank you for your work. And I mean that in all sincerity, because clearly it is challenging and rewarding and critically important to the people who walk through the door here. So with all sincerity, thank you on behalf of a grateful community.
Thank you. And I strongly think that every school should have a school-based health center.
There are people who help you, and we just want to give them a moment. If you want to introduce me, you made reference to this young lady a little earlier in the program.
This is Silvana Coletti. She's our registrar for that's just a basic title for her, but she does a lot more than that.
Silvana, hello.
Hello.
You are the person who's at the desk as people walk in and students walk in and ask for help or try to explain to you what they need. What is it like to be in that position to hear these stories all the time?
It was hard for me at first to hear the stories.
As a result of what they were challenged with or the painful health or mental health experiences that they had had?
A lot of different things. It's just your heart goes out to these kids. A lot of them just need the support, and we try to give them that.
How long have you done this work?
I've been here at the school-based health center since last April, but I've been in healthcare for about 4 years.
And end of the day, you look back, the work rewarding, challenging, a little bit of each. Tell me about your sense of this as you do it every day.
I feel it's rewarding to know that we can help these students. I've made a lot of friends. I try to lift their spirits, give them the support they need.
And it's Silvana, is the right pronunciation of your name?
Yes, it is.
Thank you. Very nice to meet you. It's a beautiful name. Thank you for your work here. And Deb, introduce me to the next person who is joining us.
This is Deb Cabrera. She's the nurse who works with us here.
Deb, hello.
Hi.
How are you?
Good, how are you?
Fine. Tell me a little bit about your tenure here, how long you've been doing this, and what it's like to be a nurse in a school-based health center.
I've been at the school-based health center for 4 to 5 years. I originally started out at Pine Valley with their school-based health center. And here, I'm Deb's nurse. Kids come in, I do basic first aid, talk to the kids, see if they need a further visit. At that point, they would see Deb, the nurse practitioner. If need be, appointments are made, kids come in, they talk to me just about anything and everything. So we just go from there and decide whether they need an appointment or if just they need some Tylenol and an ice pack.
I'll ask you a question similar to what I did at the beginning of the show with Deb Piotrowski, and that is, how are the kids today? Are they healthy? Are they engaged? Tell me about your experience in totality, generalizing a little bit about dealing with all these young people on a daily basis.
Well, there's definitely a variety of kids that come in here.
All kinds of things that you encounter on a day-to-day basis.
There's just several things, and then we just, mental health is a big thing. Kids come in, a lot of them come in, they just want someone to talk to for a few minutes. Other kids goes further than that. They need an appointment, they need counseling. There's birth control, there's kids come in, and the kids are very open these days. They come in, and once they get comfortable with you, they talk to you about everything.
And do you enjoy the work? You find it rewarding?
Yes, I do. It's great working with these kids.
Deb, thank you.
Thank you.
Deb Piotrowski, thank you for the opportunity to come and visit with you once again here at the School-Based Health Center.
You are so welcome. Thank you for taking the time to come here.
And Steve, I think we have something else that we need to do here in order to fill out the picture of this program today. You want to send us to another location?
We're going to head over to the Resource Center's Jamestown Dental Office.
We are here at East 2nd Street in Jamestown, and I'm about to introduce to you Carissa McKinney, registered dental hygienist. Carissa, thank you for joining us on the show here today.
Thank you.
We came here to find you to talk about your work at the place we just left, which is Jamestown High School. How are you a part of the clinic there? Tell me a little bit about your work up at JHS.
I'm there on Wednesdays all day and Thursdays all day, and a lot of times it's kids that have never been to the dentist before.
Stop the music for a minute here. You're telling me these are high school students and they've never seen a dentist?
A lot of them haven't.
What is it like to treat someone, to introduce yourself to someone who's never had a cleaning, never seen a dentist?
Well, it's challenging. I mean, I go over a lot of oral hygiene instructions with them, making sure that they're brushing twice a day, flossing at least once a day, going over soda consumption with them.
Do you find that to be an issue with many students?
A lot of kids are drinking pop.
I want to ask you the question then, what conclusions can you draw about the dental health of young people from those that you see at Jamestown High School? Is it okay, pretty good, a lot of challenges? What do you see?
I see a lot of challenges. I mean, I get a lot of stuff off their teeth in there, but usually once I get them on a recall system in there, they're coming back and they're looking better every time I see them.
Are cavities a big deal among high school students these days, or are we past that era?
Probably 80% of the kids that I see in there have cavities.
So then they would be referred to someone else in your clinic here or someone else in the community to have those dealt with?
Yes, I give every kid that I see a paper that they can take home to their parents or their guardian, and it has information about our clinic here on 2nd Street, and it has the names of our dentists and who they can call.
I'd just like to ask you a general question, because you're obviously very articulate and you have a great spirit. You must have great relationships with your patients.
Oh, yes. Yes, I do. Everybody that knows me here knows how much I love going to the School-Based Health Center on Wednesdays and Thursdays.
So you're very personable. So what do you think of the work as you do it with young people? You obviously enjoy it?
Oh, yeah. I love working on kids and getting to explain to them about the importance of oral hygiene.
How did you become a dental hygienist?
Well, I had no idea what I wanted to do after school, but I got my wisdom teeth out when I was 18, and I was in so much pain, and I thought, oh, maybe I'll go to school to be a dental assistant. So I was a dental assistant for 2 years, and then I decided to go back to school to be a hygienist.
So this very painful experience was a life-inspiring moment. I'm just trying to absorb that, I guess. Carissa?
Yes, it's true.
You mentioned as we began this that you had a protocol in terms of passing on some information to the young people that you see, and I got kind of hung up on the soda pop part of it, but what else do you tell them about care of their teeth today and into the future, considering they're just teenagers?
A lot of kids that I've seen have, most commonly they have bottom-out 6-year molars. So a lot of times I have to send them to get those teeth extracted. I would obviously send them here to the clinic first, but they'd have to refer them to get those teeth extracted.
You're going to have to help me and the listeners a little bit. What was that you said? Bottom-outs?
Most of the time they're 6-year molars. I've seen a lot of kids where their teeth are just decayed to the gum line. So a lot of times they need those teeth extracted.
So these are molars that they got around age 6?
Yes.
And they are so deteriorated by 15, 16, 17, 18 that they need to be removed.
Correct.
You know, that sounds like a health crisis to me.
I've had kids come in and they've actually had to go to the hospital before for IV antibiotics.
This is really eye-opening in a way that it is not what one would hope that it would be.
Right.
But still you go and enjoy the work and try and get the young people to pay attention to their teeth perhaps in a way that they never have before.
Yeah, I love teaching the kids how to take care of their teeth.
And teaching them to brush teeth? Do they have a regular protocol, the young people that you see, or occasionally, or did someone let them down someplace?
I've had kids come in and they've never had a toothbrush before, so I make sure that I'm always giving, every kid that comes in gets a toothbrush, floss, and toothpaste, and they're always welcome to come down whenever they want. If they need another toothbrush or something, we can give that to them.
Some of what you say here today is truly astonishing. How common is that experience where you run into someone who's never had a toothbrush, therefore never gotten on a regular schedule of brushing their teeth?
Honestly, I see about 6 to 8 kids a day, and probably at least one of those kids a day hasn't brushed their teeth before.
What does that mean to their oral health down the line? You talk about infection and decay. Are there other problems that the seeds are being planted for without having dental care as a teenager?
Yes, teeth with infection, that can go directly to your bloodstream and cause heart problems. There's been leads to dementia.
This is pretty serious stuff.
Yes.
Okay, let's brighten up the conversation. We have a couple of minutes here before we have to go. Carissa, let's brighten up the conversation a little bit. Speak to not only the young people who may be hearing this program today, but all of us as reminders of what we need to do regularly to ensure good dental health.
So you want to make sure that you're going to your dentist every 6 months, getting a recall exam and a cleaning. They're able to take x-rays at the clinic here. We do fluoride treatments here as well. You want to make sure that you're brushing your teeth at least twice a day in a circular motion at the gum line, flossing at least once a day, and you should use an anti-cavity mouth rinse as well at night before you go to bed.
How much of the general population do you suspect does all of those things?
Very small.
Really? Despite the obvious advantages, the obvious reasons for doing so?
Right. I would guess that most people have a toothbrush, but getting people to floss and use a mouthwash, that's probably not happening.
Our conversation has to come to a conclusion in a minute here because we're going to jump back to Jamestown High School, and Steve Watterson, who's with us, and I will wrap up this Share the Vision broadcast for today. But just a comment about this place where we are speaking right now, because we've come to find you because of your schedule here at the Resource Center's Dental Clinic on East 2nd Street in Jamestown. This is a beautiful, very well-equipped facility. I was amazed when I walked in.
Oh yeah, we're so happy to have an update. We have so much more room, more state-of-the-art equipment to use.
How many examining rooms do you have here?
We have 2 hygiene rooms. We have 4 rooms that the doctors can use, and we also have a room that is wheelchair accessible that has a Hoyer lift to lift people out of their wheelchair and goes right into the dental chair.
So this can provide dental care here at this location on East 2nd Street to virtually anyone?
Absolutely.
How many dentists, how many hygienists, how many people work here helping with dental care?
We have 2 part-time dentists here and 1 full-time dentist, and we have me, who's here 3 days a week, and at the school-based health center 2 days a week. We have another full-time hygienist here, and we have one that's part-time here 2 days a week.
It's a very busy, active place.
We're always busy.
And you have very nice teeth, by the way.
Thank you.
Anything else that we should say before we go?
Not that I can think of.
Carissa McKinney, thank you very much for your time. I've enjoyed meeting with you and speaking with you. This has been a wonderful introduction to your work at the School-Based Health Center and to what happens here at the Dental Clinic. Thank you.
Thank you.
We are going to wrap this up back at the School-Based Health Center at Jamestown High School. Steve Watterson, it is an eye-opening half an hour to come here, and we've done this a few times over the years, learn about what young people are dealing with in their teeth and in their hearts and in their bodies. I mean, it really is, I think, very valuable for us to tell the story to the community.
Oh, absolutely. And school-based health centers are making such a difference in students' lives, not just here in Jamestown, but across New York State and across the country. Every time I see Debbie, she throws in the line that she's a strong advocate for every school having a school-based health center, because you can get a sense of what we were hearing today, that they make a tremendous amount of difference in the health of these young kids.
And despite the almost 12 years that this one has been here, there are not many others around us in the immediate area.
Certainly not in Chautauqua County.
It's the only one in Chautauqua County now.
Yes.
Whoa. Well, I appreciate the opportunity to come and learn all of this, and thank you for sharing this particular aspect of the vision today.
Oh, thanks, Dennis.